Good morning and welcome everyone for joining us on today's session. Before we start, I'd like to thank the Abu Dhabi Health Authority and ECA for putting this training together to be able to welcome the children back to nursery safely and deal with any unfortunate medical instances in terms of pandemic or COVID spread. Today's trainer is Lara Hudson. She will be helping us through this training. Good morning, Lara.
Good morning, Rafi, and thank you. Oh, I don't know what's happened there. Thank you for the very kind introduction. Welcome everybody this morning to today's session, reopening guidelines training for school nurses. So before we start, I do need to just run through a couple of parts of the session. Firstly, we won't be taking any questions during today's session. However, if you do have any questions, please do add those into the chat function at the top of your screen. They will be downloaded and they will be sent to the relevant authorities. So please do just mention whether you are an MOE nursery, an ADEC nursery, or a SPEAR nursery before you write your question. If it's a question that's for HARD, DHA, MOHAP, MOHAP, then please just write that before your question, so again we can deliver it to the right people and get the right responses. Once we have the answers, those answers will then be available on the Kinderly website, which is www.kinderly.ae. Right, let's get started. So today we're going to be carrying out an introduction to the new reopening guidelines that the licensing authorities have issued. There are 9 guidelines in total, and these cover the United Arab Emirates. We're going to be looking at the roles and responsibilities of the nurse within these guidelines and look at the ways that the nurse can support the nursery leadership through the implementation of these guidelines and ensuring that their thorough understanding is held by all parties working within the nursery. We're also hoping that throughout the session you'll understand the importance of sharing the professional knowledge that you have with your nursery leadership to ensure that they get the support that they need as we move forward with this reopening. So a brief introduction first on what COVID is. It's a coronavirus disease. It's infectious and it's caused by a newly discovered coronavirus. What we do know is that it spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So at this point, we know that it's really important that we practice good respiratory etiquette, coughing into elbows, covering our mouth and nose with a tissue as we cough or sneeze. Really, really important. So the first thing here obviously is making sure that everybody in your nursery understands what COVID-19 is, and we'll come to that in a few moments. The guidelines that we're looking at today apply to everybody. They are nursery schools, independent and those within schools, these are applicable to, and also early learning centres, both the independents and those in schools, and they are Emirate-wide. There are 9 guidelines in total that require compliance. Guideline number 1 is know the latest facts. Guideline number 2, hygiene awareness. Guideline number 3, hand washing. Guideline number 4, social and physical distancing. Guideline number 5, managing staff and child sick leave and attendance. Guideline number 6, crisis management. Guideline number 7, positive relationships with parents. Guideline number 8, supporting our vulnerable populations. And lastly, guideline number 9, which looks at well-being. Within your nursery schools, you should have copies of all the relevant documentation from your licensing authorities. You should have a copy of the operating guidelines themselves. There's also a roles and responsibilities document, and it's really important that you read those 2 documents together. In addition to this, there is also a reopening plan document that your nursery will have completed and submitted to the licensing authority for the NOC approval to reopen. Please also make sure that you're familiar with this document, because obviously this is what your nursery has said it's going to do to implement the guidelines. And so from that perspective, it's important that you understand exactly how your nursery leadership have interpreted it, and moving forward the different policies and procedures that will be in place to support the reopening of the nursery. So it's important that you understand that these guidelines apply to all members of the team, and they have actually identified specific roles and responsibilities within the team. There is the nursery principal, who has quite a large number of roles and responsibilities, and this role actually covers any of the leadership team within your nursery. So it might be a head teacher, a manager, a director. So that's quite important that you understand that that title does cover a number of different job roles that form your nursery leadership. Nursery staff, this includes your nursery supervisors, or as we refer to them, teachers, nursery supervisor assistants, your assistant teachers, the admin team, any SENCOs, anybody else that's employed within your nursery. Then there are roles and responsibilities for the school nurse, and finally the cleaner. It really is important that you do have complete clarity when it comes to these roles and responsibilities. And these roles and responsibilities are not absolute. You will need to continue with your professional role within the setting as well. So these are additional guidelines that are in place until we receive further notice from our licensing authorities. It's also very likely that these are going to continue to be updated regularly as the situation evolves and changes. And so it really is important that you do understand how these changes would be communicated to you, and that you regularly go and touch base with your nursery leadership and make sure that they are aware that you're looking for any updates. I would also suggest to you that you visit the Kinderly website, because that is regularly updated, and often a lot of the updated information goes through there. There's also an FAQ document on there, as I mentioned earlier, that your questions can be answered and added to. But there's every chance that some of the questions that you have may have already been answered there, and that some updates may lie within the answers that are in there as well. So do make sure that you visit that website regularly and stay as updated as you can on the information that's coming out to everybody. So as I say, there is one document in its entirety that is all about the roles and responsibilities, and the groupings are there for you. It is important that you have read that document as the school nurse, and that you understand the roles and responsibilities of the different people within your setting, as well as your own roles and responsibilities. It's really important that at the moment within our settings, we create a culture where people are feeling comfortable to ask questions if they have any. It might be something that you want to consider yourself, as creating an FAQ document, so that there is a port of call for anybody who has a frequently asked question, and that you update that regularly yourselves. Think of the questions that the staff team may have, or the parents may have, and then perhaps create two different documents where you can put the frequently asked questions and you can respond to those. Something we've also asked your nursery staff and your leadership to think about is the languages that you might need to think about sharing information in at the moment, because it really is important that everything is clearly understood, and perhaps offering it in the languages that are spoken within your nursery would support this. If there is anything in those roles and responsibilities or in the guidelines that you don't understand, it really is important that you go and find somebody and you ask them. Good person to go and speak to would be your nursery principal, and go through it with them and make sure that before you leave them, you all have a clear understanding of what is expected. It really is important that at the moment we do all work together to make sure that our children stay safe. And as a school nurse, your role within this is very critical. We know that within every setting, the role of the nurse is important. And we know that you provide a vital service in the nursery every day. At the moment, more than ever, we require that you use this knowledge to support your nursery's principals, and give them the expertise that you have, and support them with the medical knowledge that they require. We also need to make sure that at the moment you have a really good open communication between yourself and your setting leader, and that you are able to go in and discuss all matters relating to COVID-19 in a good, clear way. Think about the different methods that you could do this. Obviously, there's face-to-face communication, clarifying things by email. Do you perhaps have a WhatsApp group with your nursery principal so that you have easy access to them and that you can get quick responses? Do you have an opportunity in the afternoon, perhaps through Zoom, to have a quick roundup of the day? Something that we do in our setting at the moment is that at the end of each day, then the nurse submits to us an overview of attendance so that we have a clear understanding of who's in, who's not in, and if people are not in, why they're not in. And remember at the moment as well that your role is about the children, but it's also about maintaining the staff's health and awareness of their own health as well. The guideline number 1, if we get started, says that it's important that you know the latest facts. So this is the latest information that's coming out about COVID-19 with regards to health and wellness, and that you're going to good sources of information for those facts. When we talk about good sources of information, we're talking about the Ministry of Health, UNICEF, the World Health Authority. We're talking about DHA, HARD. So those are good sources of credible and reliable information. Make sure that when you get the information, you are sharing it within your setting and making sure that all staff have a good knowledge and awareness of those latest facts. And sometimes some of it might have medical language in, so make sure that you've broken that language down and it's able to be understood by every member of your team. Think about how you're going to circulate information. Are you going to do an email update, perhaps a staff blog? I know that a lot of nurseries at the moment have been doing online training sessions, perhaps through Zoom or Teams, where you're sharing really good information with them and giving people the opportunity to ask questions. That's really important at the moment, that within your team, you're giving them the opportunity to come to you and ask and clarify anything that they may need to. Something else to think about at the moment is staff well-being. It's really important that you talk to them about healthy diets, boosting their immune system, how they can live a healthy lifestyle. All of those kind of things are important. What kind of techniques could you teach them to de-stress? Could you teach them some mindfulness that they can carry out? Again, just think about what you could do within your setting to help your staff with it. When you're carrying out online training for staff, it's important that they do understand what COVID is, but also that they understand how to recognise the signs and symptoms, and when they need to refer a member of staff or a child to the nurse, or perhaps to a doctor or the hospital. So again, make sure you understand those signs and symptoms clearly. They also need to understand how within your setting you're going to risk or minimize the risk of infection. So that would be all the cleaning routines that you have in place, the procedures that you have for moving toys in and out so that they can go for sanitization after use. Those are really, really important. And as I mentioned already, making sure that they understand how to have a healthy lifestyle that will support their immune system. Just to quickly mention, it's important that as per the MOE, you look out for signs and symptoms which include a fever over 37.5, cough, body aches, fatigue, a shortness of breath, sore throat, runny nose, diarrhea, vomiting and nausea, headaches, and a loss of taste or smell. So that's really, really important at the moment. Moving forward, guideline number 2 is all about hygiene awareness, and there are a number of roles and responsibilities here. It's 2.4 within the roles and responsibilities guide. Ultimately, as nurses are very aware, I know, they are responsible for their own personal hygiene whilst in the setting, and they're also responsible for being a role model for setting the personal hygiene levels of everybody else in the setting and making sure that through being a role model, they're sharing that information with everybody. During the current period, nurseries are required to wash their uniform. Nurses are required to wash their uniform on site and keep them at the nursery. Nurse uniforms must not leave the nursery and they must not go home. You must also keep a separate pair of shoes to be worn at the nursery, and these are to be separate for the ones that you wear to and from the nursery. It's also important at the moment that you keep a spare uniform at the nursery in case there's an incident that would require you to change. It's also important that you understand that you are required to attend and implement all hygiene training that's provided by MOH or your licensing authority. So again, just making sure that you keep up to date on whether there's anything out that you should be attending. So that's really, really important as well. Within your setting now, your nursery principals have been asked to appoint a designated health and safety officer. For many nurseries, this would be the nurse. I'm sure that by now your nursery leadership have come and had a conversation with you and asked you and explained what your requirements would be under this. They may vary slightly differently from nursery to nursery, so it is really, really important that you do understand what this means within your own setting. As part of this, you would be proactively monitoring the health and hygiene practices within the setting. It's your responsibility every day to make sure that there's relevant PPE is being used, that it's being used correctly, that the cleaning rotas are being implemented, that the staff understand how to implement those cleaning rotas and which chemicals are used for which, and how to store those chemicals. All of this is a really important part of the role that you have at the moment. If you happen to see an area that you don't feel is working, or where there's cleaning that isn't happening as well as you think it should be, it is your responsibility to flag this up to your nursery leadership as soon as possible, because they obviously need to be able to take action and resolve this problem as quickly as they can. Please do make sure that you are familiar with the cleaning rotas in your setting, the cleaning products available, and exactly how this is being implemented. And a lot of that information should be in that reopening plan that your principal put together to submit to the licensing authority. At the moment, we hear an awful lot about PPE, and within our nurseries, we should also make sure that we have the relevant supplies of PPE, and that we ensure that we have a good supply chain for them, and that we know that if we order it today, it will take however many days, and that we have sufficient supplies to last us until the delivery is made. So again, just making sure that you plan your usage carefully, that you know and you have backup supplies should you require them. PPE is one thing at the moment that we cannot be without. PPE should include things like masks, gloves, disposable aprons, face shields, disposable towels, full PPE suits, and shoe covers. Those full PPE suits at the moment are for your isolation area, and it's important that anybody that enters this space with somebody that is suspected to be a COVID case does put on a full PPE suit. Disposable towels at the moment, we are using those within our nurseries for all cleaning. So it is important that we do have a good supply of that. And the shoe covers there are just as an added extra should you feel that those are required. Make sure that the PPE that you're using is from a credible supplier and it's of a good quality, and that it comes with certification as is appropriate. Guideline number 3 is all about hand washing, and it is really, really important at the moment. We know that hand washing is a great preventative method and measure. It's important that in your role as the nurse that you ensure that everybody within the setting does fully understand what good hand washing technique looks like, and that they're doing this for a minimum of 20 seconds. In the sessions that we offered for nursery leadership and for nursery staff, we did explain to them the importance of having good signage up to remind people of that technique, and that they do need to be carrying it out for that minimum of 20 seconds. So that's really important. So make sure that you check the signage within your setting. Again, think about the languages it needs to be in. Make sure that it's displayed in the right places, close to sinks, and that for adults it's at their eye level, and for children it's displayed at their eye level. Where children are slightly older, it's really important that we encourage independence. For younger children, it's important that we wash their hands for them at regular intervals to ensure their levels of hand hygiene as well. It's also important that you make sure that there are lots of hand washing supplies available, and that these are replenished daily to the bubbles and the bubble rooms, so that they have everything that they need for the day to be able to complete their hand washing process. Also, under hand washing comes hand sanitizers. Within the guidelines, it does state that hand sanitizers need to be wall mounted and out of the reach of children. It's also important here to highlight that children over 2 may use hand sanitizers under the supervision of an adult. Children under 2 must not use hand sanitizers. Guideline number 4 looks at social distancing. It's very important that within your setting, your bubbles remain intact. There is a specific number of children that are meant to be within the bubble, and this with their ratio of adults. It's important that as a nurse, you understand that those ratios are in place and that you understand how your setting is managing that. Make sure that within your setting on the floors, you have the social distance signage and that it's also displayed on the wall as a reminder to parents. Think about the type of signage that you're going to use for social distancing and ensure that they are child and adult friendly, and that they are the correct distance apart. So again, just go and carry out a quick audit of your setting to check on all the signage that's in place, and just make sure that that's there daily and it's in good condition. We're urging everybody to laminate all signage so it's easy to clean. So again, that's something else just to go around and do a quick check of, that all the signage within your setting is laminated and easy to clean. Guideline number 5 looks at staff and child sick leave and absence. It's really important that if you have been working in a hospital prior to starting work at the nursery, you must self-quarantine, and that's part of that roles and responsibilities document under 5.3. It's also important that the nurse undertakes a COVID-19 test 6 days before starting back to work at the nursery. It is the nurse's responsibility to take the lead role on all aspects of health when it comes to staff and children, and that they implement all processes and procedures that relates to that health, and deals with a staff member or a child should they become ill whilst at nursery. It's important that every morning the nurse conducts a daily health check of every staff member, child and visitor prior to entrance to the nursery. It's important that a non-contact thermometer is used, and that if anybody has fever or is exhibiting any symptoms of COVID, they are isolated in the designated isolation area until they can leave the nursery, and get sent to the hospital for further medical advice. The nurse must immediately call a parent following a discussion with the principal if anybody has signs and symptoms of COVID-19 or is generally unwell. And at the moment, it's a parent's responsibility to collect their child within 1 hour of being contacted. So again, this is something that prior to reopening, you need to have flagged to the parents as something that is their responsibility, and they need to confirm that they are going to be able to comply with that. In our nursery, we've actually added that onto our registration form so that we've explained this to parents, and that parents have then signed to say that they understand that that's their responsibility. So it is important at the moment you do have in place a robust system for monitoring the health of staff and children. Have a think about your setting. Do you have a nursery management software that would allow you to manage this system? You're going to have to track temperatures every day, multiple times a day. So again, if you have a system that will allow you to do that, that's great. If not, perhaps you're going to go paper-based and have spreadsheets. Again, think about how you're going to best be able to manage that within your setting. You also have to take into account the health authority declarations. Again, contact your relevant health authority if you're not aware of what these are. Make sure that you have a full understanding. We're also required to get a declaration once a week from parents and staff. Again, the information is in the reopening guidelines for you to share that, and think about, again, how are you going to get that information updated? Do you have access to an app that would allow the parents to upload that, and where possible, minimize the use of paper within your settings? It's also important that your policies and procedures are updated with regards to monitoring the health of staff and children, and that you've put in place the various COVID measures and you've shared these with the relevant stakeholders as needed. As per the regulations, you do need to ensure that you identify any illnesses a child or staff member currently has that may make them fall under the vulnerable category. If you've identified somebody under this category, they do need to seek medical clearance to work or come to the nursery and a letter to support this. If they are not able to come to the nursery, you need to provide an alternative. This might be online learning or perhaps working from home as an option for a staff member. Again, all of this information needs to be recorded on their staff health file or on the child's health file. Daily, we'll be logging in that information on temperature and whether they have any signs and symptoms of COVID-19 or have they been around somebody that has a positive test result. A final possible question that you may wish to ask them is whether they've been given any medication that may mask any symptoms. This could include things such as Panadol. Temperatures need to be monitored on arrival, mid-session and at the end of the day, and you need to record these in some kind of record system, whether this is online or paper-based. If a child or staff member exhibits symptoms whilst they're in the setting, it's important that they are taken to the isolation room and make sure that whoever's with them is wearing the appropriate PPE. It's important then that the nursery manager, principal or leader is informed and that the parents are contacted to collect their children within the hour or ask the child or ask the staff member to leave with them. The child or adult then needs to be monitored until they are collected and taken home. And the nurse is responsible to report a confirmed COVID case to the relevant authority using the e-notification system. This should be done for students as well as staff. It's important that the nurse provides all information to the Department of Health about contacts to facilitate contact tracing in the event of a confirmed case. Letters, SMS, and using a nursery app to send home information when a positive case has happened, informing them of the exposure and indeed what needs to happen next. It's important that you then have a list of test centres where contacts should go to be provided, and this then can be circulated to your relevant staff. Guideline number 5, the roles and responsibilities are there. It's important that you follow a safe protocol for isolation. You should now have an isolation room set up within your nursery. Again, just read through your internal reopening plan so you understand what your centre is doing and how they've put that into their plans and their response. If they do begin to, if a staff or child does begin to show signs and symptoms of COVID-19 while at nursery, they must be isolated instantly and the parent, guardian or emergency contact be notified immediately, and then they need to be referred to hospital where the necessary action will take place. The patient cannot return until the PCR result has been obtained. If the result is negative and there is a clinical assessment of a probable COVID-19 case, the patient must complete a 14-day quarantine. If the result is negative and there is no clinical assessment for a probable case, the child can return to the nursery as long as they are symptom-free. If the result is positive, the nursery is to be closed immediately. The trace contacts of the patient, including other staff members, along with classmates of the child or colleagues, are all considered close contacts. A close contact is somebody who has spent more than 15 minutes in a proximity of 2 meters with a positive case from the day of symptoms onset or the day of the PCR test. They must all commence the 14-day quarantine counted from the day of the positive PCR test or from the day of the onset of symptoms if ascertained by the clinician. They are not to return unless they are granted a clearance certificate by MOHAP stating they have been discharged from isolation. Should you have a case of a COVID emergency, the nursery must follow your endorsed guideline for emergencies by the school's nurse or doctor while wearing adequate PPE. Also, your health and safety in charge must ensure that the child is accompanied by an adult wearing full PPE while being transported to hospital. So again, 5.3.7, it's important that you do monitor the child and staff's health. If you find that child is just generally unwell, they do need to be isolated. Again, getting them to leave the nursery as soon as is possible within that 1 hour time frame. It's important that your isolation room is separate to the clinic, and that it's your responsibility as the school nurse to ensure that deep cleaning and disinfection takes place as soon as the isolation room has been used. If in the event your isolation room was being used, it is important that you do have a backup room designated, and that staff members and children from different bubbles must not use one isolation room at the same time. So again, just have that planning in place and those backup thought processes there. The isolation room, this is somewhere where you would put any child or staff member that is showing signs and symptoms of COVID. And just to reiterate again, it must not be the nursery clinic. Following its use each and every time, it must have a complete deep clean, and it must be sanitized, and you must ensure that you have a backup plan in place should the isolation room already be in use. Think as well about what you will need in that isolation room to take care of a child or staff member that is unwell for that period until they are collected. For guideline 6, all nurseries were asked to prepare a crisis management plan, and this was one of the documents that was forwarded to the licensing authorities to get the approval for the NOC to reopen. Again, it's a document that it would be good as a nurse that you familiarise yourself with, and that you understand any roles and responsibilities that you have within that plan, and also the policies and procedures that may pertain to you as part of that plan. The crisis management plan is there, and it looks at how you're going to deal with a situation or an emergency as it arises, and it deals with the emergency right from the planning stage all the way to the post-emergency response. So there's lots of roles and responsibilities as you work through that plan. It just makes sure that you've brainstormed in advance any situations that may arise and any potential responses that may be required, and that you've been able to put plans in place to ensure the sustainability of the business and the safety of everybody that's involved around your business. And one aspect of the crisis management plan was looking at pandemic planning and pandemic emergency responses. So again, just make sure you've gone through that and you have familiarised yourself with the different elements within that plan. Make sure that you've identified within the plan as well who your first aiders are. Make sure that you do have sufficient staff that comply with the first aid requirements, and that you understand when their renewal dates are so that you can plan to get them retrained as required. Make sure that if you've read the plan, if there's anything that you think needs to be fed back to your nursery principal pertaining to the medical side of things, and the medical response that each crisis would require, that you've given that information to your nursery leadership so they're using your expertise in the correct way. We also talked as part of the crisis management plan about putting in place emergency grab bags. And these are bags that you grab as you're leaving a nursery should there be an emergency, and they contain items that you would need to be able to deal with that emergency. So obviously a very critical aspect of this would be a portable first aid kit with sufficient supplies in it to be able to manage the number of children and staff that you would have on site, and making sure that the contents are within their expiry date and fit for use. Also within that bag, there were a list of other items that your nursery could consider having. So again, just go through that with your nursery leadership and make sure that you understand what the items are. And if you feel that there's items missing, then again, take the time to flag that up and explain why you think those items need to be there. Guideline number 7 looks at positive relationships. As nursery schools, we're really good at having fantastic relationships with our children, families, and our staff. It's important now more than ever that we continue to do this, that we have really good methods of communication in place, that we can be responsive and that we can have good clarity as we communicate. Make sure that as you start to welcome children and their families back, that the information that you have on file for them is current. Most importantly, contact telephone numbers, email addresses, information around medical history, that at this time is really important for us to have. We've also encouraged nursery leadership and nursery staff, and again, it would be good for the nurse to consider doing this, is offering online sessions for parents to discuss any issues that concern them. This is a very, very new situation, and it's a very new way of returning to nursery. So again, taking the time to reassure parents as much as we can, and making sure that we share with them the different things that we have in place to support their health and well-being over this period. Take time as well to go and speak to the different staff members about their health and their experience of COVID-19, as many have had a very, very difficult few months and may need additional emotional support, or may just need somebody to listen to them and help them by talking with them. So again, take some time to do that. It is important that as the nursery nurse, you are an approachable person, and that people will be happy to come to you and bring any issues that they have. Remember, there are a number of daily routines that you're going to be undertaking with children and staff. So again, making those as positive and as engaging as possible will help significantly. Guideline number 8 is about supporting vulnerable populations. This is 8.3. So again, if you take time, the nurse must monitor the staff and children who are vulnerable or part of a vulnerable population within your nursery. So it's important that you do identify who these people are first. You need to make sure that for anybody that could be considered vulnerable, that you do have a doctor's letter if they are coming to nursery to show that they are safe to come in. And the nurse needs to put in place a plan to continue providing services and therapies for children who are from a vulnerable population. So again, this would include things such as online learning, and we are encouraging nursery leaders to collaborate with organisations that would support them in doing this. For the purpose of these guidelines, a vulnerable population is a person of determination who has physical or medical disability or needs. Person with a weakened immune system, perhaps they have a chronic illness such as heart disease, hypertension, diabetes, or chronic respiratory disease or cancer. Or a person with a compromised immune system from a medical condition or treatment, so perhaps somebody that's been undergoing chemotherapy. So again, it really is important at this time that we do identify those who are vulnerable, and that we take time to identify the risks, get them to come and provide letters as required. If we can, provide online learning opportunities for children who are unable to come in. And for staff, either get them to provide a fit to work letter, or if they're unable to work, look for opportunities for them to be able to work from home. Guideline number 9 does look at well-being. Do take time to have a read through it and think as a school nurse how you would be able to support well-being within the setting. Again, there's lots and lots of different ways that you can do it. You need to work with your nursery leadership to identify how is going to be best to do that for your staff and your children. Okay, I would like to say a big thank you for joining us today, and for taking time to work through this PowerPoint with us. As I say, if you do have any questions, please do put them into the chat function at the top of your screens. These questions will then be forwarded to the relevant licensing authority. So please do make sure you mention which licensing authority you fall under. If it's a question that you would like forwarded to one of the health authorities, again, please just note that at the beginning of your question and we will do so. All of the responses to these questions will be placed on the Kinderly website under the frequently asked questions section, and this is updated very, very regularly. So do make sure that you return to it and visit it as often as possible. And if you leave the session and you think, oh, I had a question, then again, there is the option of adding that at the Kindly website, and that question would then again be forwarded over to the relevant person, and we would get the response for you. A big thank you once again for attending today's session, and we wish you a lovely rest of your day. Thank you.